Hey guys, welcome to the IAMed live channel today. And joining me today, Chris with IAMed, and I have Andy Fedino, one of our critical care paramedic instructors here joining me. And today we're going to talk about the shift pass-off. Now this is something that's near and dear to my heart because just like our last episode talking about how to prep yourself for success on your shift, this is another good topic to discuss about, hey, what to do when you show up. You know, when I walk through that door, there's certain things that me as a crew member, I want to know right off the bat. And I think it's a very good point and a good time to have and invite some critical discussion and maybe some education. Yep. So, what are some of the things that you like when you walk in the door, Andy?
When I come in on shift, obviously there's some givens. Coming on shift, they're coming off shift. You want to know, what's the equipment status? Did you guys use a bunch of this? Did they use all the oxygen? Did they use this? Did they intubate somebody? So,
is equipment not working? Is the ventilator failed? Are we out of end-tidal waveform capnography adapters? You know, that's important.
Absolutely. So those are the givens, okay? Beyond that, there's some things that I do want to just put out like a little legal coverage. It is the best time to do your narcotic count, okay? As you're coming on shift, they're coming on shift. You have all sorts of eyes. Everyone throws their signature down because what can happen if by chance somebody forgets to throw a signature, they leave.
And they leave. And we've all been there. You know, I've been there where I've driven down the road almost 35 minutes home just to get a phone call and go, hey, Chris, so about those narcs.
Guess who has to drive all the way back?
Have you seen them? I'm like, yeah, they're in my flight suit in my Tupperware in my back of my car, which is not a good place to be. So first off, you got to call the regional manager and say, hey, I kind of made a oops. And I learned from that, you know, so I think we've all been there.
Absolutely.
But Andy, you made a good point. Like, that is a good time. You have four eyes. Everybody's looking at it. It's a good CYA thing, but it also just to knock it out. Get the formalities out of the way, the high weight stuff, so that way when you go home, you can stay home. You don't have to drive all the way back to base.
Absolutely. Absolutely. I think it's a really good time during that pass-off period. I just have a personal interest. The question that wants to come out of my mouth is, did you guys do anything cool yesterday?
How are your flights?
How are your flights? How are your flights? And it opens a conversation. You're just sitting around having some coffee, okay? Sitting around having some coffee, and yeah, we had this call, and I couldn't get their PEEP up, and this was happening, and
they kept crumping, or I gave this, and then this happened. I used to have, you know, I remember one discussion we had around the coffee pot, so to speak, and it was just like they were talking about how they had an RSI, and they kept giving sucks, and after the third dose, like they couldn't get paralysis, and you know, we've all been there, and first and foremost, this should never be punitive, guys. This should be always a learning, teaching, and, you know, safe environment.
Safe environment.
But I was like, hey, first question I start thinking is was the IV infiltrated, or did you have a good IV access? And you know what? The crew went back and said, you know what? We did at first. They checked it, and they might have lost it at some point. And, you know, and that was just something in that moment that they just didn't catch. You know, and so I've also been on the receiving end of that. Like, hey, Chris, did you ever consider this? You know what? No, I didn't, but thank you very much. I definitely will consider that. And guess what? Now it just reaffirms, because we know we're always learning clinicians, you know, and we can only do so much, and sometimes we forget, you know, and sometimes it's like, duh, I totally knew that, and I should have done that. And these are where those teaching moments come in.
Absolutely. You know, one thing that I often hear you talking about is your passion towards customer service. How in this period can we best optimize the ability to serve our customers? What do you feel?
You know, I think it's a great opportunity because, one, you could reach back to the crew and go, hey, you know, what facilities you guys go to? They just left their print. They just went out there and touched those facilities and said hi, picked up and transferred patients or dropped patients off. You know, this is a good opportunity to maybe give those facilities a call after you're done with your brief and go, hey, I just want to follow up and just see how everything went the other day. You know, I know our offgoing crew came in. Is there anything that we could have done better? Is there anything that you guys need? You know, it's a good kind of customer service point, not only to show that you care, and I will truly, honestly say that every base that I've worked at, I put that sort of empathy in with all of our customers that we serve, because they are. Whether they're our patients, the facilities that are sending the patients, or the facilities that are accepting the patients. You know, we should treat them all like our customers. And I think having respect and being able to go back and say, hey, is there something we could have done better? Because we all know what happens when we make a mistake when we leave the facility. They don't tell us. They literally just, hey, maybe we call another service next time. Or they just, you know, I walk in, or the next crew walks in and they're like, why am I getting all this hostility? I don't understand why. You know, and so this is a good opportunity because we know that in our industry, at least my opinion is, we don't communicate very well. or as well as we probably should, and be empathetic and be understanding and non-aggressive and non-judging, I guess is a better word to put it. But
Absolutely.
this is a good point for you guys to go out, reach out to your base, your customer base, check in, see how things are going. Do they have any training events coming up? Like, this is a good opportunity to get some good information. And that was all given by the off-coming crew.
Absolutely. I do like how you pointed out, you said the word being understanding. And I think that it's also really important to point out this right here, is that as we're coming onto shift, we just put out our last live, IAMED Live, was that we have prepared for our shift, okay? So at this point, we're doing our pass-off, and we are coming onto shift. And the person that we're coming onto shift with, our partner, they're also fresh. However, the crew that's going off, they are at the end of their shift.
They're smoked. They're
They
gassed.
are smoked. So if there's one thing I can just put out there to just be like, okay, well, obviously we're all thinking it, but let's put it out. Let's be understanding, okay? Couple of B shifters right here.
Hey.
All right? So innately in our own minds, we're always like, those darn A shifters, they're always slacking, right? But they're totally not. They're just like us, okay? It's just we see them at the end of their shift, okay? So when you're coming on shift, be understanding to that crew, okay? If by chance, there's no such thing as going to be a perfectly stocked helicopter or fixed wing or ambulance or stocked refrigerator. Man, like
anything.
Nothing will be perfectly stocked ever. So
it's not reality.
It's just not reality. So change your mindset, okay? Don't imagine that you're supposed to be in a world where everything is already stocked. That's why we have jobs. We put stuff in the shelf.
And this is why we have a fresh crew come on to do
Exactly.
checks and go through that and be thorough. One of the things I like to do is take my checklist and go out there on day one and go through everything. I open every little bag, take every little thing out, look at all the expiration dates, wipe my entire aircraft down, do an entire walk around. So I set that aircraft up for me, my crew, my shift for success. And it's not to talk bad on the other crew. Because guess what? I might get 3 critical flights in a row. And next thing I do, I forget to restock one thing, or I didn't catch a spot of blood over here.
Yep.
It's inherently human. But this is also why we have layers of safety. And when we talk about that safety chain, communication is right there first and foremost.
Absolutely.
So,
Absolutely.
What are some other things we could take away from this? This is a good time for critical discussion.
Oh, yeah.
Hey, what did you guys do on the last shift, and how could I have applied it differently? Because we all know that getting from A to B for me might be different from Andy. Andy might choose to take a different path to get to B. And I want to know as a clinician what that path might be and what his rationale is, because that's a learning moment. Like I said, these are all supposed to be non-punitive, safe space, learning moments to help improve everybody. And going back on what you mentioned about being gassed out and fatigued, how do you guys do your shift reports for passovers? One of the places that I worked at that I did appreciate, we had a whiteboard. Right next to the front door was a big old whiteboard that was our shift change. So that way, as we'd go throughout our shift, we would list, type of flights that we went, places that we went, PR events that we did, maintenance events that might be coming up, stuff like that. So that way, if I'm out on a flight, when the ongoing crew comes in, well, they can quickly look at that board and have a general idea of how my shift is gone. And know that, like, hey, when they land, like, let's give them some food, let's give them some water, we're going to take over and see what they need, And that is where being a team player comes in, because, dude, I will tell you, there's nothing better than a gas crew member coming back after you're coming off shift that day, but you got tapped out late. And you just want to get home to your bed and your family, and to have an oncoming crew come out and be so receptive and go, how can we help you guys get your butt out that door?
Absolutely.
And still meet all the boxes that we need to check.
Absolutely. In whatever environment, whether you're at the fire department, whether you're at the hospital, whether you're on your medevac, being there for the oncoming crew, it's just so considerate.
So a little tag on is I do have a very big passion in just mental health awareness, in the provider. And we know that we do not do good clinician care, self-care. And so I would wholeheartedly invite you guys to go check out the Code Green campaign. Look at some of those lists in there. So maybe, as you guys are doing some of these shift change, that's a very good opportunity to do a check-in or a buddy check. Check in. Hey, how was the flight? How are you feeling after that? Because I know for me, sometimes I don't start decompressing and processing some of these flights until I'm actually driving home. And just to have someone reach out and go, hey, it looks like you guys had a really rough shift. Chris, if you're driving home, you need to talk, give me a shout, or if you know someone that's not really being connected, or maybe they're not being so outgoing, or maybe they're aggressive or snappy. These are all signs that we can use to hopefully identify emotional burnout, emotional trauma, and hopefully start guiding some resources to some of these people to help prevent some of the long-term effects. And we know that those long-term effects are there, and that is one of the black eyes, I would say, of our EMS community, in our industry, is we don't take good self-care.
Yeah,
and so I really want to put that out there. This is a good opportunity to debrief with your fellow crew members. Who better to talk about a crappy event than with you, my partner, and then, so I really just want to put that out there real quick. But anything else you want to add, Andy?
No, that's it. I wanted to thank you for putting that out there. I think that that's very important to maintain our own positive mental well-being, okay? And I think that that's for all of us, okay? So, absolutely.
Yeah. Well, hey, thank you guys for joining us today with the shift changeover and kind of what to look forward to and how to set yourself up for success when you guys are doing your shift change. Hopefully some ideas and pearls that you guys can take away. And if not, please share your own. So thank you for joining us today and stay safe.
Take care.